Hello and welcome to NorthBay Healthcare's Doc Talk Live. With us today is NorthBay orthopedic surgeon Andrew Brooks. He's going to talk about knee pain and the options available. Take it away, Dr. Brooks.
Hi, thanks for joining us. I assume if you're logging on, you're interested in finding out about arthritis. Obviously, arthritis affects many of us. It's very prevalent. 600 million people worldwide are seeking care from their physicians for arthritic problems. 60 million people in the United States are doing the same. The majority of these are women. The majority of them are people over the age of 65, but it's not uncommon for even younger people to need care for arthritis. But there is a misconception amongst many people about exactly what arthritis is. And I think in its simplest terms, you think about the joint, weight-bearing joints primarily, as functioning with nice, smooth, soft cushion and cartilage. And in patients with arthritis, that smooth covering of the bones is damaged, missing, or diminishing. As that occurs, you start to notice increasing pain, and the pressure into the bones is what you feel. The nerves are in the bones. So as you lose the cushion, you have more and more pain. Now, there are multiple kinds of arthritis. The majority of the patients I see have what's called osteoarthritis, and that is what people classically call wear and tear arthritis. It occurs with age. It's highly correlated with obesity. There's also post-traumatic arthritis, when someone's had an injury to a joint. That can leave the joint damaged and more susceptible to developing arthritis. There is what's called autoimmune disorders, such as rheumatoid arthritis or lupus or psoriatic arthritis, where the body develops antibodies against its own cartilage and can damage articular cartilage, knees, hips, shoulders, fingers, elbows, even at very young ages. And many people have heard of gout, which is another type of inflammatory arthritis which can damage your joints. The prevalence of arthritis seems to be increasing. We're seeing more and more patients in our offices, and that's happening worldwide. In fact, surprisingly, the lowest incidence of arthritis is in the state of California and Hawaii, and the highest incidences are in the southern states of the United States. The United States has more arthritis patients seeking care than any other country in the world. What are the symptoms of arthritis? Well, pain, primarily. Swelling, inflammation, your joint might be warm. You can start to see deformity over time. As you lose function, you become more and more inactive. As you become more and more inactive, you suffer other problems as well, maybe loss of work, loss of quality of life that can be associated with depression, anxiety, insomnia. As these symptoms worsen, it cascades into a bigger and bigger problem. But hopefully you've sought treatment before all of that cascade occurs. The diagnosis is typically made from a history with a doctor, as well as x-rays. But there are some forms of arthritis that need MRI or laboratory studies to determine. What most people are interested in, of course, is arthritis treatment. What can I do? Not everybody that has arthritis needs an operation. There's many things you can do prior to having to have surgery. But the treatment depends upon the severity. If you see your doctor early on in your arthritic problem, the stages of your arthritis, the treatments are almost always non-surgical. But remember, there's no cure for arthritis. It does progress over time. People try taking supplements, and that's a big business out there. A lot of money spent on supplements, but I cannot tell you with certainty that any supplements have been effective at reversing or halting arthritis. Despite that, I have patients who take different supplements who feel some relief, and as long as they're not risky or too expensive, it's probably worthwhile. There are diets for arthritis, special anti-inflammatory diets for arthritis that people are trying, topical lotions, over-the-counter medicines such as Tylenol, arthritis medicines, anti-inflammatory such as Advil, Motrin. Almost never do we take opioids for the management of arthritis. If you have an inflammatory arthritis, that requires a visit with a rheumatologist who may prescribe some other medications. Physical therapy has been shown to be very effective for restoring strength and motion in patients with arthritis, and we use that frequently. As we get older, not only do we develop symptoms of arthritis, but we get stiffness, weakness, we lose balance, we lose strength, we lose endurance, and all of those things can be addressed with physical therapy to improve your situation. There are certain braces that we try for patients with certain types of arthritis. Splinting can be helpful, and injections. Probably the mainstay treatment for non-surgical treatment is injections, and we use sparingly. We will use corticosteroid injections or steroid injections. That's not something we like to repeat frequently, but once or twice a year, generally, it's pretty safe, and it helps eliminate the inflammation. And I tell patients it's a little bit like using eye drops when your eyes are inflamed. It helps get rid of inflammation, so it can be very effective. If those fail, or if you're not a candidate, then we will try viscosupplementation, which is a thick, viscous oil that we will inject into your knee, and it contains hyaluronic acid, which is a component of your cartilage and your synovial fluid. And in some patients, not all, but probably the majority of my patients, they will receive benefit from those injections that can last from 6 months to a year. There's no side effect with those injections. They're very safe to repeat, so we use those frequently. We are now using platelet-rich plasma injections, and there's been more and more education and research done on platelet-rich plasma injections. And that is where we separate the platelets and the plasma from your blood, and we inject those back into a knee. The platelets contain growth factors and healing factors, and they can result in less pain for your knee, but it will not change the appearance of an x-ray or the appearance of the inside of the knee. It's strictly for pain control, and we've had relatively good success with that. Those injections are for patients with mild to moderate arthritis. They're unlikely to help if you're completely bone-on-bone arthritis. We are not using stem cell injections to grow new cartilage in the knees. That has not been shown to be helpful, and is at one point was done in a lot of clinics, but is no longer done in the majority of clinics. In a couple of research centers, maybe, but that's not mainstream treatment. Eventually, you may need to consider surgery depending on the severity of your disease. And that's a discussion you'll have with your orthopedic surgeon. But basically, the time to consider surgery is when your quality of life is suffering, when you've tried all these other things, when you can't do the things you want to do, when your pain is severe, when you think about your knee all the time, then it's time to consider surgery. And obviously the most common surgery for arthritis is joint replacement, whether that's partial joint replacement or whole joint replacement. That is obviously a big surgery, big recovery, and there are risks with those surgeries. So it takes a very careful discussion with your orthopedic surgeon to make sure you understand exactly what all of this entails. It is generally extremely successful. However, some people are simply not happy with their joint replacement. But about 800,000 to 1 million joint replacements are done every year in the United States, and that number is expected to grow tremendously over the next 30 years. We can replace the knee, the hip, the shoulder, the elbow, the wrist, the ankle, and some joints in your hands. Rarely would we do arthroscopy strictly for arthritis. So people asking, what are some of the trends, the newer trends in orthopedic surgery as far as joint replacement goes? And I would say that we are really focusing now on rapid recovery. We're focusing on optimizing a patient's health prior to coming in for their surgery to minimize their risk of complications. We do a lot of very short stay surgeries where people are going home after one night in the hospital, and there are more and more surgeries done with patients going home the same day. If you look across the United States, you'll see that more and more joint replacements are being done in surgery centers where patients go home the same day. You have to be healthy enough and have enough support at home to be a candidate for that. Besides accelerating rehabilitation and recovery, we're looking at other ways to improve patient satisfaction, whether it's the use of robots or computer navigation or customized cutting blocks. That's being done everywhere to try to improve overall satisfaction. We look at pain control after surgery because knee replacement is a painful surgery and a difficult recovery, and we use multiple different types of medications to help diminish your pain after surgery, along with special injections, and it's much better now than it was previously. Most patients are relatively comfortable after surgery. We're considering joint replacement now in younger and older patients than we used to, as long as they're medically optimized for surgery. The materials that we use are better and last longer. Knee replacements used to wear out because the plastic liner in between the two metal pieces used to wear down, and that would cause a problem. But those materials now are so good that there's very little wear in that liner, and the knees are lasting longer. Unfortunately, the most common reason nowadays to need a knee replacement is probably infection, which can occur in about 1 to 2% of patients. So maybe somebody may have some questions for me.
We have a number of questions. You were talking about diet. So what kind of foods should you avoid if you have arthritis?
So a lot of patients ask about diet, and there are anti-inflammatory diets out there. The Mediterranean diet is an anti-inflammatory diet that's rich in whole foods and avoids a lot of processed foods and a lot of sugary foods. And I'm just going to refer you to a very helpful website, the Arthritis Foundation website. So you can Google Arthritis Foundation. That website has multiple exercises that you can look at, videos, diets, a lot of suggestions for patients with arthritis. And so I will refer you to that website.
And we'll put a link to that website in the comments after we post this.
Okay.
Does massage therapy help?
Yeah, massage feels great, right? I mean, if you've got a sore, stiff knee or hip or shoulder or wrist or elbow, massage helps with the symptoms.
Okay. So if you're experiencing arthritis, should you start with your primary care doctor and ask for a referral, or can somebody go straight to an expert like you?
Typically, the way our system works is you will go to your primary care doctor first and request maybe an appointment with an orthopedic surgeon. Some insurance companies demand that. Some will allow you to go straight to the orthopedic surgeon. It depends. I mean, we want to make sure you have been seen by some physician generally prior to seeing an orthopedic surgeon, but it's not mandatory.
So you talked about diet, but are there other things you can do to prevent arthritis from developing?
You can't necessarily prevent arthritis from developing. Some people have a genetic component, so they've inherited a gene that makes them more susceptible to it. But you can do things to help minimize the progression of the arthritis, such as keeping a reasonable weight, staying active and healthy, keeping that joint moving, and keeping strong. As I said before, there are many studies showing the benefits of physical therapy to keeping range of motion and strength in a joint. But unfortunately, we don't have a magic pill that you could take that's going to prevent or reverse your arthritis.
So when should a person seek medical care for knee or hip pain?
If you have new onset pain in a hip or a knee or a shoulder, then most people will self-treat with anti-inflammatories or Tylenol or maybe some activity modifications. But if it's been going on for a few weeks and not improving, then you need to seek treatment, especially if it's limiting your activities.
Okay. Kathy is asking, and thanks for tuning in, Kathy. If a patient is 10 months post-knee replacement and has a lot of pain and stiffness, would the gel injections be an option?
If you've had a total knee replacement, then the gel injections will not help. So there's no point in doing the gel injections. But unfortunately for Kathy, I mean, she may be one of those 10% of patients who are just not entirely pain-free after their surgery and can have ongoing issues. But she needs to make sure that she's been to her doctor, complained about it, and has an exam and x-rays, make sure there's nothing else going on.
Okay. So do supplements actually work? Are there any
Well,
help
the
there?
Journal of the American Medical Association did a big study on supplements a few years back. They had thousands and thousands of patients, and their ultimate conclusion was that the supplements don't help. But as I said before, I do have patients that will take supplements, and some of them feel some benefit. So not everything works for everybody. Not everything doesn't work for everybody. So if it's safe and it's reasonable cost, then you can try supplements.
So this person's asking, how do you determine whether to have a partial or full knee replacement?
So there's a big difference between a partial and a full knee replacement. A full knee replacement, you know, the entire joint is resurfaced. In a partial knee replacement, only half of the joint is resurfaced. So you have to be a candidate for that surgery, and the only way you know if you're a candidate is if you've been to an orthopedic surgeon's office who does that procedure, who has examined you, spoken with you, and done x-rays. If you have arthritis and pain on one side of the knee only and everything else looks fine, you may be a candidate.
Okay. So what you talked about PRP, is that for arthritis or is that for injuries? What do you use it? And could you explain again what it is?
Yeah, the PRP is the platelets in the plasma from your blood that are injected into a knee. And it is primarily indicated for knee arthritis. However, in some injuries or an injury on a knee that already has some arthritis, we might consider using PRP to accelerate the healing. It's very safe. Insurance companies don't cover it, so you have to pay for it. But the indications for using PRP can expand a little bit.
Why does cold weather seem to make arthritis worse?
So that's a very common question everybody wants to know. And usually, and people say, well, when it's raining, my arthritis is worse. Usually, anytime the barometric pressure is dropping, this is the hypothesis anyway. Anytime the barometric pressure is dropping, such as when it rains or gets really cold, then inflammatory tissues can swell and you can have thickening of your joint fluid, which causes stiffness and pain in an arthritic joint.
Okay. What foods should I consume to fight arthritis? Now you said Mediterranean diet, but what does that mean?
That's whole foods, unprocessed foods, no sugary foods. But instead of me going into a big discussion of that, I just refer you to that Arthritis Foundation website because it's perfectly laid out there for you.
Are there certain exercises you should do or should not do when you're dealing with arthritis?
If we're talking about the knee primarily, we're trying to avoid anything that causes a lot of repetitive impact. So some of the mistakes that my patients make would be that they want to do impact activities like high intensity aerobics or Pilates or lunges or squatting or hill climbing or stair climbing. Those can generally aggravate the knee. So we want to go low impact exercises, elliptical trainer, the bike, flat level walking, weightlifting, stretching.
This person's asking, is there a best age to receive a knee replacement, or is there an age that's too old to have one?
So the age for knee replacement, we used to not even consider it unless you're 65 or older, and that was because the implants back then weren't lasting as long. But now our implants last longer, our technology's better, and so we're happy to do it in much younger patients. My youngest patients have been in their 30s, but those are patients that may have rheumatoid arthritis, a real severe debilitating arthritis. I've done a knee replacement in a 95-year-old because physically he was like a 70-year-old. So he was very healthy. But it depends on your health primarily.
So what happens when a knee replacement wears out? You said they're lasting longer, but what if it wears out?
Right. So I try to explain that to people. I say, getting a new knee is not like getting a new set of tires in your car. And when that knee replacement wears out, it is a much bigger operation to replace a replacement. You have loss of bone, putting a new implant in there much more difficult. Obviously, now that we're having almost 1 million joint replacements done every year in the United States, we're seeing more and more people who need what are called revisions, and those revisions are much bigger surgeries than their original joint replacement.
Anything else you want to add for people who have questions about arthritis or?
So I would recommend you also go to, and we'll probably hook this link, orthoinfo.org. Orthoinfo.org is a website that's hosted by the American Academy of Orthopedic Surgeons. It has very good, accurate information and data for you.
All right. Well, we're at the end of our time. Thank you, Dr. Brooks, for taking time out of your busy day. And this will live on Facebook. We'll also put it on the NorthBay YouTube channel.
No, thanks.